Why does graft-versus-host disease happen after a lymphoma stem cell transplant? Imagine giving someone a new set of immune cells to help fight lymphoma, but instead of just attacking the cancer, these cells mistakenly see the patient's own tissues as threats. That's essentially what happens with graft-versus-host disease, or GVHD, after a stem cell transplant for lymphoma. When a patient with non-Hodgkin lymphoma receives stem cells from a donor, those cells develop into a new immune system within the patient's body. But because the donor's immune cells are not an exact match, they can recognize the patient's tissues as foreign and attack them. This mismatch mainly involves human leukocyte antigen markers, or HLA markers. These are like identification tags on cells that tell the immune system which cells belong and which are foreign. Every person has a unique pattern of these markers, except for identical twins. When the donor's immune cells, especially T cells, encounter cells with different HLA markers, they see them as threats and launch an attack. This immune response is what causes GVHD. The process begins when the donor's T cells recognize the mismatch in HLA markers and become activated. These T cells then attack various tissues, especially the skin, gut, and liver, which are common targets. Sometimes, other immune cells like macrophages also get involved, creating additional inflammation and tissue damage. The severity and timing of GVHD can vary. It usually appears within the first 100 days after transplant, called acute GVHD, but it can also develop later, known as chronic GVHD, which can last 4 months or even years. In the context of lymphoma treatment, GVHD is a tricky situation. On one hand, it can cause serious health problems and increase the risk of complications. On the other hand, it can be beneficial because the same immune attack that damages normal tissues also helps eliminate remaining lymphoma cells. This is called the graft-versus-tumor effect. Studies have shown that patients who develop GVHD after an allogeneic stem cell transplant often have a lower chance of lymphoma relapse and may even have better overall survival. Doctors work hard to balance these effects. They try to find the closest possible HLA match between donor and patient to reduce the risk of GVHD. They also use medications to suppress the immune response if GVHD develops, aiming to prevent severe complications while preserving the anti-cancer benefits. The severity of GVHD can range from mild and self-limiting to life-threatening, so early detection and treatment are crucial. Understanding why GVHD occurs helps patients grasp the importance of donor matching and the careful management needed after a transplant. It also highlights why ongoing research continues to improve strategies for preventing and treating GVHD, making stem cell transplants safer and more effective for lymphoma patients. Always remember, each person's experience can be different, so personalized medical advice from healthcare professionals is essential.